So in this video, I'll talk about everything that you need to know about panic disorder, what it is, how it's maintained, as well as how do we treat it using cognitive behavioral therapy. If you're new here, hi, my name is Parky. I'm a postdoctoral fellow in clinical psychology at Stanford University, and I've been studying and practicing evidence-based mental health for the better part of a decade, and I'd love to share some of that information with you. So the first question we have to answer is, what is panic disorder and how is it diagnosed? So according to the DSM-5, panic disorder is diagnosed when we experience reoccurrent, unexpected panic attacks. So it happens at least a couple times in our lives, and it happens kind of out of the blue. So there's no particular reason for it. It wasn't like you were doing a presentation or you were really scared of a spider. They just kind of seem to happen all of a sudden, and the anxiety reaches a peak within minutes. And to meet specific criteria for what a panic attack is that you have to meet at least 4 out of 13 symptoms, including racing heart, sweating, trembling, shortness of breath, feelings of choking, chest pain or discomfort, nausea or abdominal distress, dizziness or lightheadedness, derealization or depersonalization, so the sense of like unreality or feeling like we're outside of our own body, fear of losing control, and fear of dying. So fundamentally, the fear of panic disorder is a fear of our internal bodily sensations and what they potentially could mean in terms of catastrophic consequences. So what I mean by that is that essentially we're worried about our racing heart, we're worried about our trembling or shaking or feeling too hot because of what it could mean in terms of maybe we're having a heart attack or an aneurysm or something really terrible happening that then increases our anxiety and then creates a self-fulfilling prophecy because our anxiety increases and our physical sensations get even stronger until we end up in a full-blown panic attack. So unsurprisingly, people with panic disorder very reasonably worry about having panic attacks, and they do their best to kind of avoid them or endure them with really great distress. So they try to get away from them as soon as possible, either through breathing or stopping what they're doing, something to get away from the possibility of experiencing a panic attack. So to give a very clear example of what this can look like as a cycle in terms of a cognitive behavioral therapy framework is that essentially there's an initial trigger, something in an environment that we perceive as a threat that increases our anxiety, and as our anxiety increases, we notice the physical sensations like racing heart or feeling cold or hot or whatever that might be, and then as a result, we have a catastrophic interpretation of what these symptoms mean. Like maybe I'm having a panic attack, maybe I'm having a heart attack, maybe something is terribly wrong, and then of course this increases our anxiety more, increases the physical sensations, leads to even greater catastrophic misinterpretation that eventually leads to a full-blown panic attack. So just to give a couple specific examples, let's say you just finished up walking some stairs, or you were in a really stuffy car and you were feeling really hot and your heart was racing, and then you had sort of like a catastrophic thought of like, what if I'm having a heart attack? What if I'm about to faint or I'm having a panic attack? And that increases your anxiety, leads to even more physical sensations, leading to more interpretations until you're kind of in that full-blown cycle and leading straight into a panic attack. And of course, people very reasonably don't want to be on the cycle and they want to reduce their anxiety as soon as possible. I've had patients tell me they go for their anxiety medication or go do some breathing exercises, splash their face with cold water, or just leave their house so that they can be in the cold so that they can kind of reduce their anxiety. And although this all makes very good sense in the short term, they actually counterintuitively maintain our anxiety about panic disorders in the long term. So I once had a patient come to me for treatment of panic disorder, and surprisingly they actually had done panic disorder treatment a few years back, and they learned some relaxation exercises, things that helped them reduce the frequency of their panic attacks by a lot. But recently the panic attacks really popped back up and they really needed treatment again. And the reason why this happened was because relaxation exercises really only help to treat panic disorder at a symptom level. They make sure that the symptoms never get to a full-blown panic attack, but it doesn't treat the underlying cause of panic disorder, which is our fear of internal bodily sensations, our fear of having these symptoms and of having panic attacks. So therefore, one thing that we really need to do is be able to kill the fear of internal bodily sensations. And the best way to do that is through a practice known as interoceptive exposures, which is basically just a fancy term for being able to sit with these symptoms of anxiety, symptoms of panic, and not running away from them, not engaging in some sort of safety behaviors to subtly avoid them, like using alcohol or doing breathing exercises. We're really allowing ourselves to experience everything just as it is without trying to change it. So the first step to interoceptive exposures is to figure out the symptoms of anxiety that bother you. So for example, you might really check and assess what are the symptoms that really bother me in the sense of like creating a sense of anxiety. Would it be a racing heart, a sense of dizziness, feeling really, really hot or stuffy, feeling really cold, hyperventilating, or feeling like I'm not getting enough air? What are the symptoms that really bother you? And you can even rate them 1 to 5. 1 being like it doesn't really bother me at all, and 5 being like, oh my gosh, this is something that really scares me. And the second thing to do is to figure out the activities that elicit these symptoms. So for example, if it's a racing heart, you might think about doing push-ups or running in place or jumping jacks. If it's about dizziness, you might spin in place. If it's about feeling hot, you might wear something really warm like a winter coat. If it's something else, you can really think about any of these ideas that could elicit the symptoms, like breathing through a straw, staring at yourself in the mirror to create a sense of disassociation. All of those things can be really helpful to start brainstorming and generating ideas of what you can practice on a day-to-day. And of course, I really want to make sure that these practices are challenging but overall manageable for you. So you might even create a bit of a hierarchy in terms of how much you want to do something. For example, if you really want to elicit symptoms of dizziness, you might start by saying, okay, I'm gonna spin around for just 5 times. And then you might make your way up as you're getting more and more acclimated, you're recognizing that you're more resilient than you thought, that you can handle the symptoms better than you thought. Then you might spin for 10 times and 15 times. As you get better and better at practicing and developing this resilience, then you can kind of build your way up. Kind of like when you're building muscles, you're starting with the lower weights and then you're building into higher weights and the stronger weights until you're like super powerful and you're Superman. So fundamentally, there's a couple different mechanistic pathways as to how exposures work. The first is through habituation. And the idea behind habituation is like the more that you experience and see something, the less of a response your body's gonna have to the same stimuli. So the first time that you see a really cool roller coaster and you get on it, it's like super, super exciting. But by the 10th time or the 100th time, you're like, I kind of experienced this all before and it's not that big of a deal anymore. So that's habituation. And the second one is through new learning. So our body, our brain kind of makes beliefs and predictions as to what would happen if we put ourselves into a potentially threatening or dangerous situation. But the more that we're doing this, the more our brain gets new learning that says, oh, like maybe I'm more resilient than I thought. Or maybe the symptom of heart racing or dizziness wasn't as dangerous as I thought. And as this happens, this new learning happens, our anxiety begins to reduce. So the general protocol for practicing interoceptive exposures is to practice it at least a few times every day so that you're getting quite a few repetitions in, really practicing with sitting and tolerating with these different physical sensations. And I also encourage you to rate your anxiety before you practice it, after you practice it, and then as time progresses, how do the anxiety levels change? And you can rate it from 1 to 10, 1 being no anxiety at all, to 10 being like extremely, extremely anxious. And of course, you want to start with some sort of exposure practice that is challenging but manageable. So maybe getting you to like a 6 or 7 out of anxiety so that you're not immediately jumping to the high level and then ending up kind of feeling like this was a terrible experience. And of course, you do really want to check in with your medical provider before doing interoceptive exposures, just so there's no underlying medical condition that could be exacerbated from these practices. So I personally believe that interoceptive exposures are a very important first step for treating panic disorders because they really get to the core of what the fear is all about, which is this fear of internal bodily sensations. And there are also other strategies that can be certainly very helpful as well. So one of them being cognitive strategies. As you saw in the model, there's often a catastrophic misinterpretation of what it means to have these panic symptoms, that I won't be able to function, that I'm having a heart attack, that I'm going to die. All of those things, of course, exacerbate the cycle and make it more easier for us to eventually end up with a panic attack. So one thing that could be helpful as part of cognitive strategies is the use of countering, where you're basically bringing in facts and evidence that does not support the thought. So one of my patients often had a catastrophic interpretation of his symptoms of I'm having a heart attack. And this made very reasonable sense because his dad had passed away from a heart attack about a year prior. So of course he would be very worried about having something similar happen. But one thing that he noted was that he actually had a doctor's visit a little while ago and the doctors gave him a clean bill of health and his heart was as healthy as a horse, as he described it. So that was something he could tell himself to counter the thought that he was indeed having a heart attack. And over the course of treatment, this patient did some really wonderful work with the interoceptive exposures and the cognitive strategies, and over time he developed this really resilient frame of mind about how he handled these panic symptoms, that he was likely not having a heart attack for one, and even if he did, he'd either be dead and there'd be nothing to worry about, or he'd have a new lease on life and really prioritize his health. So it was a little bit of a silly joke, but underlying it was this really powerful frame of mind that reduced his overall anxiety about the catastrophic consequences of having these symptoms, and that paradoxically reduced his frequency of panic attacks to zero because he just wasn't worried about it anymore. And of course, just because interoceptive exposures tend to be what I think fundamentally is going to be the most important tool for treating panic disorder, that doesn't mean there's no room for other types of treatments like relaxation exercises. I think relaxation exercises can be incredibly helpful to cultivate a sense of general stability and reduce fight or flight and anxiety on a daily basis. And I think this can be overall really helpful once your fear of panic attacks are gone, because then you can just work on reducing your overall anxiety, increasing stability, and just feeling awesome in your day-to-day. Anyway, that's all for this video. Thanks as always so much for watching. If you did enjoy it, I encourage you to subscribe because I'll be continuing to talk more about evidence-based mental health down the road, and certainly me, as well as Tweety in the background, would totally appreciate it. Take care.